What we need to know about Listeria. What is Listeria? Listeria is a bacterial genus that contains 7 species. Listeria was named after Joseph Lister, an English pioneer of sterile surgery in 1940. All species within Listeria genus are gram-positive, non-spore-forming, catalase-positive rods. Listeria is classified in the family of Corynebacteriaceae. The most pathogenic within the genus is Listeria monocytogenes. Listeria is unusual among pathogenic bacteria in that it is able to grow at low temperatures, making it psychotrophic. It can grow at temperatures down to 0 degrees Celsius very slowly. This gives it the ability to multiply in refrigerated foods. Listeria is also significantly tougher than many other bacteria found in foods, being slightly more resistant to heat, drying, and even irradiation. Listeria can be found in soil, which can lead to vegetable contamination. Animals can also carry the bacterium, leading to contamination of foods of animal origin, such as meats and dairy products. Listeria has been found in hot dogs, deli meats, raw milk, cheeses, raw and cooked poultry, raw meats, ice cream, raw vegetables, raw and smoked fish, and cantaloupe has recently been implicated. Listeria infection causes vomiting, severe headache, fever, muscle ache, stiffness, cramps, abdominal pain, nausea, diarrhea, eye infections, and even constipation are common symptoms. What is Listeria monocytogenes? Listeria monocytogenes is unlike most other foodborne pathogens that only cause the typical symptoms of gastroenteritis. Infection with Listeria monocytogenes is much more likely to result in more serious symptoms and usually takes the form of meningitis or septicemia. Relatively few healthy adults become infected by Listeria monocytogenes, and the total number of cases worldwide is far lower than the number of people infected by Salmonella and other food poisoning bacteria. It is potentially serious consequences of infection in vulnerable consumers that make it so dangerous. Those most at risk are the elderly, pregnant mothers, and immunocompromised individuals. Another factor is the very variable incubation time of listeriosis infection. It can be up to 2 months or more after exposure to the pathogen before symptoms appear, which can make it almost impossible to trace the source of infection for individual cases in smaller outbreaks. Recently, more than 100 individuals have become infected with Listeria monocytogenes due to contaminated cantaloupes. On November 1, 2011, the Center for Disease Control and Prevention reported a total of 139 persons infected with any of the 4 outbreak-associated strains of Listeria monocytogenes from 28 states. 29 deaths have been reported. In addition, 1 woman pregnant at the time of illness had a miscarriage. What does Center for Disease Control recommend? Center for Disease Control recommends that consumers not eat whole or pre-cut Rocky Ford brand cantaloupe from Jensen Farms. Even if some of the cantaloupe has been eaten without becoming ill, dispose of the rest of the cantaloupe immediately. Listeria bacteria can grow in the cantaloupe at room and refrigerator temperatures. Cantaloupes that are not known to have come from Jensen Farms are safe to eat. If consumers are uncertain about the source of a cantaloupe for purchase, they should ask the grocery store. Can listeriosis be treated? Yes, it can be treated. Listeriosis should always be treated with antibiotics. With severe symptoms, a hospital stay is usually recommended. As soon as diagnosis is suspected or made, intravenous antibiotics should be administered in severe cases or for high-risk patients. How can we prevent infection with Listeria? Avoid certain foods, especially for people at high risk. Listeria can be killed by proper cooking procedures. Make sure all foods are cooked to proper internal temperature. Make sure foods are stored properly, checking the temperature of the refrigerator. Use a thermometer to make sure the temperature is at least 40 degrees Fahrenheit or colder. Use correct sanitation procedures. Person-to-person transmission does not occur, but Listeria can be spread by contact with an infected product or surface, such as countertops or hands. Washing hands frequently while preparing and handling foods is the first step to a healthier kitchen. If you would like more information on Listeria, you can contact the Center for Disease Control and Prevention at 800 CDC Info.